Welcome everyone to the Mirror of Intimacy monthly webinar on emotional and erotic intelligence. My name's Dr. Alexandra Katehakis, and today is Monday, September 13th, 2021. Our topic today is pain, which is an interesting topic because it's so multidimensional. It's good, it's bad, it's painful, it's enlightening. There's so many aspects to pain. To begin here with our quote of the day by Stephen Levine, who wrote extensively about death and dying. But he writes in this morning's quote, "Wanting things to be otherwise is the very essence of suffering. We almost never directly experience what pain is because our reaction to it is so immediate that most of what we call pain is actually our experience of resistance to that phenomenon." So let's think about that for a moment. Wanting things to be otherwise is the very essence of suffering. So whatever you want may be what you have. So if you want what you have, and you can be in gratitude in the moment, no matter how deep the suffering is, to find some piece of gratitude for being present, for even being alive, that is a moment where you're escaping suffering at that time. And that we almost never directly experience what pain is. I mean, think about that we don't really put our deep attention on the pain because we're so busy reacting to it. And sometimes our reaction to the pain is much bigger than the pain itself. And so what we're calling pain is the resistance to the pain, not the actual pain. And I would encourage you to really study that quotation and to consider it greatly, because we often make a story about something, and the story is 10 times worse than the actuality of what we're going through, because what we're going through in the moment feels unbearable, feels unfair, feels like it should be otherwise, or someone else is getting the life that I didn't get to get, which is more of being a victim and feeling like things are unfair. And pain can be emotional, it can be physical, it can be psychological, but usually it's a combination of the both or all three, because if it's physical, then we're going to have an emotional and psychological reaction to it. But the question is, can you modulate how big the reaction is? And to really make the query of, is it real? Is this really real? Is it really so? Is it really true? Or am I making a mountain out of a molehill? And just remember that it can always be worse. The suffering can always be worse than what we think it is. And that doesn't negate the current pain that we're in, but it can help to put things into perspective. So if we think about psychological pain, we think about oftentimes the ending of a love relationship. That something happens, and we often use the language of feeling brokenhearted because our hearts literally feel like they're breaking or shattering into a million pieces. And that's because we literally feel pain in the heart. And sometimes when people have heart attacks, it's because they've been feeling so much pain, not just a physical pain in their chest, but a literal emotional pain in the chest, because we do have a lot of neuronal networks around our hearts in our chest area. And some neuroscientists call it our second brain. And Buddhists talk about thinking with your heart and not with your head, because a lot goes on in our physical body. And this idea that we can separate our minds from our bodies is erroneous. Now we know that we're actually in our bodies and our bodies are in us. So it's important to think about the organism, our human beingness, ourself, as an integrated whole, not these disparate parts. So if your body's having some kind of pain, it's talking to you, it's telling you something. When we fall in love, we form these attachment patterns, which are akin to, you could say, dendritic growth in the brain. where we're growing towards the other in a particular way. The sound of their voice lights us up, the touch of their skin, the smell of their skin, their smile, their eyes, the whole totality or essence of who they are. It starts to, we start to attach to that person in ways that is almost like, not the same, but almost like growing another limb. And so when that limb is severed, because this is such a deep weaving of, physical and emotional psyche and body together with another person, when that severing happens, it can feel like the loss of a limb, because we can't separate, again, this brain, mind, body pain from one another. So it's important to think about that when, people say they were in writhing pain or they were on the floor in a fetal position when they lost someone they loved. And we've all known that pain. It's because it hits us so deeply. And I'm sure many of you saw and heard some of the ceremonies or reports about 9/11 survivors over the weekend. There was sort of beautiful speeches in Western Pennsylvania. 60 Minutes did a stunning recap of the whole time. And there were some incredibly painful and poignant stories that were shared. And you could feel how alive the losses were in the people sharing the stories of the loved ones that they were so attached to. And I found myself in tears just hearing the stories of the people that were attached, because they were such stories of honor and glory and bravery and pain and suffering. And all of that is true. We tend to negate those kind of internal connections in our culture. And so I'm making an invitation to ask yourself about what psychological pain do you feel today that's related to the loss of a loved one, whether physically or emotionally, or even sexually, the loss of a lover, the loss of their body, the loss of that feeling. Those are real feelings that get connected. And that's why it's so important to be mindful about who we intertwine our energies with. In the name of being sex positive and being sexually liberated and free, we often throw caution to the wind and have sex maybe indiscriminately, for fun, for free, what have you. But there's often a price to be paid for that. And it's naive to think that, yeah, you can just get out of that unscathed sometimes. Not all the time, but sometimes. If you click with someone, it may be more painful than you thought it was going to be when you don't see that person again. And sexual pain, whether it's unconsciously elicited or intentional, differs from other sorts of pain, because that sexual pain can have to do with sexual abuse. It can have to do with actual physical pelvic pain disorders in males and females. And so you want to be careful about not overriding pain, because physical pain is telegraphing to us that something is off. You know, you can hurt your back and it can be just centimeters off from center, maybe even millimeters, but it feels excruciating. It feels like something major has happened, and really you just strained your muscles a little bit. And they're inflamed, or something shifted slightly. And with some stretching and maybe even physical therapy, over time, it all goes back into place and the muscles relax and you're fine. But it can feel huge in the moment. And the bigger the story we make about it, the more exaggerated the pain gets. And I think it probably takes longer for us to heal. And we all have different levels of pain tolerance. I mean, certainly it's said that women have higher pain tolerances than men do because women give birth, and that requires a high pain tolerance to get through. But these pain tolerances are as unique as our fingerprints are, I think. Some people can take very little, and some people can take a lot. And so you don't want to compare yourself to other people. And some pain can also be trauma based, and some pain can be chosen, if people enjoy pain in their sexual pleasure, for example. And it's not uncommon for unresolved trauma to manifest itself in the body. And that can create all kinds of conditions for painful sex, for sure, for women, and also performance anxiety for men. Sometimes men who ejaculate quickly have tight pelvic floor muscles, and so that can be painful also. But I'm just suggesting that if you have any kind of sexual pain, that you ask yourself, well, what kind of pain is it? Why does it hurt? Is it hurting because I'm not speaking up for what I want and need? And I'm just allowing somebody to do something to me that really doesn't feel good, but I'm just going along to get along because I don't want to look weird or not sexual or off in some way? Or is it pain that I'm choosing because I like a really hard touch? I don't like a light touch. It makes me uncomfortable if somebody doesn't firmly touch my body in a specific way. All of those things are very unique and personal. So it's up to you, it's up to all of us to get clear about and be curious at the very least about an inquiry of what really feels good to me physically. And if it has to do with trauma, how am I paying attention to navigating painful sex? And am I making the difference between a lifetime of healthy or unhealthy sexual practices? So, for some, unresolved trauma can be a part of their sexual template, and yet it may also feel very rigid, or it can feel incredibly shaming or humiliating if it's being repeated over and over again without an intentionality. And this is a fine line here, I think, because there are people that are aroused by high levels of shame and humiliation during sex, but they know that about themselves and they're choosing it. Um, and they're not just reenacting something blindly. If you don't know where that came from, and or you do know, let's say you grew up with a father that was incredibly shaming and rageful and humiliating, and so you seek out men similarly that are abusive to you, and it's not intentional for you, that you really don't talk about it with anybody. You let people do whatever they want to do to you, and sometimes they hurt you, or you've gotten beat up, or something worse has happened, raped. Then you really want to take a look at that, because even though high arousal, physical pain might be sexually arousing to you, wouldn't it be nice if you'd gone through a course of therapy and afterwards you decided there were certain acts you still like that had to do with rough sex, but instead you could communicate it to a partner, and that you were finding partners that were listening to you, that were consensual with you, that agreed to, safe words and setting boundaries and limits around how far you could go, so that you know that you would never get beat up or raped again. Those are very big distinctions in what's okay and what isn't, and what I would quote call healthy or not healthy sex. So think about what your arousal template is, and what psychological pain, um, or when psychological pain follows physical pain, is that really what you want to be doing? Or do you want to shift it by degrees in a way where it feels safer and better for you? Um, so, do we have any questions here? Yeah, here's one. How do you deal with the pain of a 20-year coupleship when your husband, who presented himself as heterosexual, now tells you that he likes the male genitalia over vagina, and that he's not attracted to my vagina but to other vaginas, and that he likes his sexual fluidness? This is coupled with years of sex addiction and acting out with transsexual women. I'm also dealing with the pain of him at age 58 wanting to live as a woman and attract men. Is this part of the addiction that he now wants to be what he used to act out, or is he wanting to experiment living as a woman so that he can attract men? I'm very confused. Well, it sounds to me that I actually don't read this as very confusing. I think he's telling you what he wants, and maybe you're not hearing what he wants. And maybe you haven't had a clear, explicit conversation with him, because from what I'm reading and what you've written, it sounds like he doesn't want to be with you anymore, that he wants to live a different life. And if after, 20 years, sometimes people do come out of their own denial or their self-deception and recognize that they are same-sex attracted, or they are more sexually fluid and they enjoy sex with both sexes. And that doesn't mean that, well, you would have been duped in the beginning if they were duping themselves, because self-deception is required to deceive other people. So he may just not have known what he knew about himself at that time. Or maybe he did and he was just lying the whole time. I don't know. But I think it's important for you to hear that this is not the partner for you now. He's saying he doesn't like your genitalia and he wants to be with other people. So unless you are interested in being in an open marriage where you have rules around consensual non-monogamy, I think he's telling you that this relationship is over for him. And maybe this is on you to hear that and not try to make it work. Because I want to caution all of us about confusion. Confusion's not a feeling. When we go into confusion, it's a form of mild dissociation. We don't want to know what we know. We don't want to hear what we're hearing, and we don't want to live with the reality of what it means that we have to do in order to move ahead in our lives or move forward. So please have more explicit conversations with him and make sure you're really hearing what he's saying and that you're listening, because it may be time for the two of you to separate. Think again about when you're in pain, whether it's the kind of pain we just heard about or physical pain, that you're out of alignment, that something is askew, something's not fitting, something's not right. And it's so interesting to me how we always seem to override our best judgment. We seem to override what we know, what we're hearing, what we see, in order to make excuses for the other person, or maybe more importantly, convince ourselves that what we're doing is okay and that we should stay, even though we're getting a lot of markers and a lot of messages that we shouldn't stay. And so I always tell people that I think you have to pick your pain. It's the pain of staying and being stuck and things essentially being the same as they've always been, or the pain of leaving, which is going to require you to grow in ways that are unimaginable to you because you can't see them yet. And so they're both painful demands, and it's really the earmark of a true dilemma. When you have a two-choice dilemma and neither options look good, you have to choose the one that is going to bring you the most in the end. And when I say the most, I'm talking about our personal growth and development. Is staying in a long-term marriage that's unhealthy, where I feel stuck, where I'm never going to have sex again, good for me, even though it's painful, or is leaving that same marriage good for me, even though it's painful? And I think when you hear it that way, most all of us would choose the latter, that it's time to go, even though it's going to hurt like you know what. um, so make sure that these sexual behaviors aren't leading to exhaustion and despair, that the sexual behaviors you're engaging in, if they're painful, or even the relationships, if it's painful, it's because there's something constructive happening, something changing, something alchemical is on the horizon, and something new is going to emerge from enduring the pain, which is often what happens when we stay in relationships and we're working through things. But both parties have to be willing to work through. Both parties have to be willing to take themselves on, to face their own limitations, to really look at themselves. Then there is, in part, what I've been talking about, which is consensual pain. And sexual pain during consensual sex play in states that are considered mutually fun can be quite enjoyable. And this is assuming that a couple has talked about what turns them on sexually, what they like, why they like it. They've been able to answer each other's questions about that. And they have a roadmap for what is in bounds and what's out of bounds. And so they're practicing what I would call consensual play. Somebody writes, I can't seem to break the cycle of being attracted to unavailable men like my father. So hard to break this cycle. Any clues? Well, I would say that that is a piece of work that requires a lot of depth exploration in therapy. It's not something that you can just understand, because understanding doesn't change our patterns. It has us understanding the patterns, but really going back to that earlier time and looking at, and not just looking at, but feeling the enmeshment with that parent is what's required in order to shift and change those pattern behaviors. These are adaptive strategies in the brain and in the body that require expert attention in order to change them fundamentally, to change the functions and the structures first and the functions of our brains and nervous systems. Let's see, my partner died more than 2 years ago. My family and friends tell me that it may be time for me to try and enter the dating world, but the pain of losing my partner is still so present. How do you know when you're ready? Well, I would encourage you to do some more grief work if you haven't, to find a good grief counselor or a good grief group. There's no statute of limitations on grieving and how long it takes for us. 2 years is a long time, but maybe you need 3 years. I don't know. And I think you will know when you know it's time. You'll feel it. There will be a fundamental shift internally. But if you haven't fully grieved the loss and also fully grieved the fantasy that you had, and also look at the ways that you're still holding on because you're afraid to feel again. When you love someone deeply, the biggest gamble of loving deeply is the pain of losing. And most of us don't throw our hearts onto the funeral pyre, if you will. We're always holding back a little bit because somebody's going to die first. And you don't want to be the one that dies first because, you don't want to have to deal with the pain of losing the person that you love, and which is what you actually had to go through. So risking your heart again means that you could lose someone. And yet that is what is laid before you. That is the invitation to you to grow in this lifetime, to be open-hearted again, to risk loving and losing yet again versus not loving again at all. So just do a check for yourself to ask yourself, have I really dived deeply into this loss? Do I need to take another shot at it to see what's there? As someone who is working through recovery from sex addiction, I'm experiencing low sex drive in my relationship, and my low from in my relationship, which is now the first healthy relationship I've been in for a long time. How do I increase my interest in sex in a loving, secure relationship when my sex drive was otherwise focused on danger and unpredictability? Well, that's an intimacy question. This is about practicing intimacy, not intensity. So how much are you really making contact with your current boyfriend or girlfriend? How close in are you? What are you really talking about in terms of your fear? How slowly are you connecting during sex? And how much are you not present, checked out, looking for intensity, and not really understanding what the demands of intimacy are, which require, again, a very close in look at your partner from many, many different angles. And if you haven't worked that through, then maybe it would be helpful for the two of you to be in couples therapy, where you start to talk about the things that you're squeamish about, where you're turned off, where you're afraid to get close, why your eyes aren't open during sex, or why you just want to hurry up and get to orgasm, or whatever the issues are. I don't know. These are just some. But I appreciate the question, because a lot of people in recovery from sex addiction struggle with a more analog experience, with a more day in and day out, slow experience. of what would it be like for you just to lay side by side and gaze into your lover's eyes, for minutes on end. What kind of discomfort does that bring up for you? How uncomfortable are you really being seen, really being vulnerable because you've been hiding all of that for so long? And what are your deepest, darkest secrets, your issues about your discomfort with your body, or feeling used sexually, or whatever has gone on in your life? And how willing are you to talk about those? And let your lover see how much pain you're actually in, and how afraid of sex and contact you really are. Not about getting off or having sex, but about the deep vulnerability that comes from sharing ourselves sexually. So that's a great question, because it's an enormous amount of work. It's not just about stopping the problematic behaviors, it's about diving deeply into who we are. And I was talking about bodily pain, and just a reminder that pain is, as I said, it's telling us that something is wrong, or that a healing is taking place, to the body, to the mind, to the soul. And this is where you want to focus your attention: is, what is this pain? What am I avoiding? Why am I making a story about how horrible this is, when is it really that horrible? We have another question here. As someone who has vaginismus, I've been through the process of physical therapy, and now I'm encouraged to seek sex therapy in addition to my treatment. What should I expect if I decide to go through sex therapy? I don't think I've experienced any sort of trauma that I would have to process, but I'm open to trying. Well, my guess is you've experienced something, because vaginismus is a reflexive action. It's like when you go to the doctor and he hits your knee with that little rubber hammer, and your knee flops up, your leg flops up. That's reflexive. So your vaginal muscles are reflexively tightening. Your pelvic floor tightens, it grasps. And that's what we call muscle guarding. So something happened, somebody gave you messages about sex being dirty, shame, wrong, something like that. These are either messages you got from your family, or your culture, or your religion, or school, or you were bullied, or something came around that had you, that part of your body grasping and shutting down. So certainly physical therapy is essential. Working with your pelvic floor muscles, learning to breathe, using vaginal dilators that help you tolerate the tightness, because it really is about loosening the tight muscles. But also, what are you thinking about during sex? What are you afraid of? What goes on in your head, and what goes on between you and your partner? That is worth an investigation, and you really can't do one without the other. I think when people have vaginismus, they need physical therapy and psychotherapy. One without the other leaves you falling short of what you need to investigate. So I appreciate that you're curious and that you're open, because that's what will be required in the therapy that you do. I don't want to dismiss or devalue biomechanical problems. They're real. If you really have back pain, or you really have knee pain, or you've got some kind of post-surgical discomfort that's in the way of having sex, then you have to honor that. And that's when you want to learn different sexual positions. There are plenty of books. I think there's a book called Sex with Back Pain. I'm sure it's something like that, that show you how to prop yourself up and use pillows and adjust for what you need. And again, these are intimate conversations and intentional conversations with the partner. When you say, look, I need some physical aids here because I have a problem. I have a knee or a back that hurts during sex. I mean, certainly people that are not able-bodied know all about props. And if you have a spinal cord injury, you've been using props to have sex for a very long time. Those kind of props are available through Dr. Mitchell Tepper's website. You can find other things online also, but make sure that you are not abusing yourself. If you're having sex and you're in pain, your partner's not doing that to you. You're doing that to you. You're fundamentally hurting yourself because you're not speaking up for yourself, because you're too embarrassed or too ashamed, instead of saying, hi, I need more lubrication, or hi, I need a pillow under my back, or hi, I don't like that. That's hurting me right now. Or whatever the situation is, to be able to stop and talk about that is what it means to have an adult sexuality and not be behaving like an adolescent where you're giggling or you're embarrassed or you can't talk about your body parts. So don't violate yourself. And make sure that you are also breathing during sex and slow down. I'm really fascinated still at how many people think penetrative sex is the end all be all of sex and sexuality. There's so many other pleasure centers in the body, starting with the skin. The skin is the biggest organ in the body. We have so many nerve endings all over our bodies where we can be touched and caressed and suckled and every other thing, kissed, licked, you name it, that bring us great, great pleasure, massaged. So think about slowing sex way down, breathing during sex so that you're breathing into your belly and into your pelvis, not this shallow breathing in your chest where you're panting, so that you're lightheaded or out of breath. But use your full body with its limitations and all of the permutations that all of us have, and cultivate mental health through the connection with your partner and the quality of the conversations that you're having, so that you're creating an atmosphere of relaxation. And this way you'll be able to expand your tolerance for pain and pain-free sex even after you've had an injury or a medical problem. But don't be shy about talking about sex, and talk about it anytime. If during the sexual act you're starting to feel pain, or you don't feel right, or something's coming up, your abuse is coming up, and you're starting to cry or get angry, stop and talk about it. There's a beautiful, beautiful intimacy in allowing whatever emerges during the sex act to be present. I think we have this idea that everything's got to be all packaged up in a certain way, so that there is, kissing, some foreplay, penetrative sex, orgasm, and then you're done. And that's what constitutes good sex. But there's something so reductive about that, and disinteresting, really, especially if you're doing it the same way over and over and over again. And something more curious when you allow yourself to not know where the sex act is headed, when you're willing to fumble, not look so cool, maybe be scared or feel vulnerable or not know what you're doing. In that emerges something deeply erotic because of the vulnerability. So the more suave you look, the more together you look, the more you can bet you're invested in a performance, and the less you're invested in being vulnerable and discovering the erotic from within. I want to, someone writes, I want to overcome vaginal pain during intercourse, yet I don't have a motivation to confront the fear of the pain. I know dilators help and I could start small in other ways, but I'm scared of pain or don't want to spend my precious limited time working on it, even though intercourse is something my partner ultimately wants. What are some questions or topics I should be exploring? Well, it seems to me there's only one question here, and where does your lack of motivation come from? Because if you're not motivated, if you're not doing this for yourself, because you're curious about your own body, because you want to have a healthy sexual life, then you shouldn't subject your partner to this, because it's not fair to ask someone to live with this kind of limitation, because this is just going to drag on and on and on because you don't want to do it. So until you get to the bottom of why you don't want to do it, or you're resolute and I'm just not interested, a sex life is not interesting to me, it doesn't matter to me, then it's not really fair for any partner if they don't know where you stand with your own body and your own sexuality. So I would say that this is definitely a therapy issue to explore. Why don't I want to go forward? What am I so afraid of? Um, I equate this to if you had a bad hip or a bad knee and you were in pain all the time, would you go get hip replacement surgery or knee replacement surgery? Some people wouldn't. They would just live with that pain and that physical limitation until that leg eventually atrophied. It would get smaller than the other leg, and you would lose use over time, whether it was a knee replacement or hip replacement. And if you talk to people that have had these surgeries, even young people, they talk about how miraculous it is, how they can downhill ski and dance and do everything they once did. So it depends on, if you want to live without limitation or not. We have another question here. How do you deal with the pain of deception, lack of honesty, the rejection and loss of self-love that comes as a result from being someone who has sex addiction? Well, I would say first and foremost, you get into recovery. And it's in the recovery process and through working the 12 steps that people start to feel a sense of compassion and self-forgiveness and redemption. But unless you do that work, you will not be able to forgive yourself, and you will always live with that pain and suffering. Um, oh, this just got amended. This is from living with someone who has sex addiction. Well, the only way to get over any of that is if your partner, if you're with that person, and that person is in recovery, meaning they are working a strong 12-step program, they have a sponsor, they're working the steps, they have a therapist, they're in a group, they're doing everything they possibly can to get to the bottom of their trauma and the underlying mechanisms that led them to have these double lives, to be deceitful and to hurt you. And they're making what they call a living amends to you every single day. You also, unfortunately, have to do some work. It's not enough to say to the recovering sex addict, this is your problem, go fix it, because you've been the recipient of that trauma. It's been deposited into you and onto you. And so you're now a traumatized person. So if you don't go get help, and understand what happened to you and make meaning out of what happened to you and decide whether you want to stay with this person or not, you will live in the misery of that pain. Which is really horrible for your physical body, for your adrenal system, your immune system, your psychological system, your bodily based system. So I would encourage you to get as much help as you possibly can by finding a good therapist that works with betrayal, partner betrayal trauma, getting yourself into a group for betrayal, reading books, going to therapy, retreats, you name it, doing what you can so you can heal from within. And so you can make a sound decision about whether you want to stay in that relationship or not. What I'm talking about is cultivating mental health with a partner, if you have a partner, through these conversations, through relaxation, through an open heartedness. And in these instances where there has been loss, whether it's recovery from partner betrayal trauma, where you feel so betrayed, or you're the person who was the betrayer and you feel so terrible about what you've done, or you've had prostate surgery and you have difficulty with erection, or you have vaginismus that you're working through and you're trying to be more open and relaxed, or the body's lost some kind of mobility. If you can avoid the additional pain of complaining or comparing yourself to other bodies or making stories about how other people got the good guy or the good girl, or other people got the good marriage, or other people got the person that wasn't sick. We can always compare ourselves to other people and fall short, as opposed to saying, I want what I have, and I'm going to work with what I have. And if what I have is broken, I'm going to admit it to myself. I'm going to stop badgering my partner for doing what they did, for being who they are, because that's just cruelty. And if you think about why you got involved with this person in the first place, there was some part of you that saw something in them, some part of you that loved them. They're still that person, even though they've got chinks and, warts and scars and everything else, just like we all do. And maybe you can't live with that anymore, but it's not fair to bludgeon that person or beat them up or make them feel worse than they already feel, because that just serves to make you feel bad. So why not be honest with yourself and just say, I can't live with this any longer. I have to go so I can grow in a different way. So this is about being compassionate and being kind to oneself and to each other. and not perpetrating more pain. So ask yourself today if you're engaged in a psychologically or physically painful sexual practice. And if so, um, when do you start? When's it time to look at those issues and talk to your partner about how you can have a healthier sex life, or to look at yourself? And if you have physical ailments, take time to investigate what positions feel most comfortable for you and how can you incorporate those particular props into your sex life in a way that is consensual and deliberate and just not embarrassing. It just is what it is. And oftentimes these are temporary situations, if you're lucky, that you can work with and work around. We have another question here. I'm interested in any insight on how to stay embodied and maintain motivation for sex in spite of intense chronic pain and illness, primarily brought on by trauma. Well, I do think that this is a mindfulness practice, and that Stephen Levine is pointing to a particular kind of mindfulness that really warrants cultivation at all stages of life, because there will come a time when we'll all need it, when we can watch the phenomenon happening in our body. That's assuming that we're not in so much excruciating pain that we can no longer hold our prefrontal cortex online. There is a point where the body can't take anymore, and where those capacities aren't even available to us. And that's somebody who is going through extreme chemotherapy, for example, or somebody struggling for their life, or the pain is such that they feel like they're, quote, going out of their minds. That makes mindfulness so much more difficult. But if it's somewhere in the middle, if it's more moderate to severe pain, it is about finding a way to develop a mindfulness practice. And there are plenty of meditation centers around the globe that teach people mindfulness meditation, and that would be your best bet. And someone writes, as well as how to communicate pain level and needed adjustments to my partner while staying in the moment. Oh, that's part of the last question. Well, if you are present and you're in the moment, all you have to say to your partner is, I need to stop right now and I need to make an adjustment. That is being present. And it is being explicit about what you want. And if your partner is patient with you and compassionate, they'll understand that these adjustments and readjustments have to take place. But I would challenge you to focus on the pleasure you're experiencing in the moments you have pleasure, and or to see if you're hyper vigilant about not experiencing pain, because those are two different things. All right, so I think that's probably a good note for us to end on. I hope you all have a pleasurable day that's pain-free, but if it isn't pain-free, if somebody bugs you today or somebody hurts you or something comes up, see if you can notice the pain, to dive into the pain and not make a story about the pain, because remember, that's what creates suffering. So I hope you have a wonderful September as we usher in fall. And as the season starts to change, if indeed they are changing now with climate change, everything seems to be topsy-turvy, but we do seem to be ushering in pumpkins everywhere I look. So enjoy the color change at the very least, and I look forward to seeing you in October. Take good care, and I'll see you then.